A urinary tract infection, also known as a UTI, is an infection of any part of the urinary system: the urethra, the bladder, the ureters, or the kidneys, usually caused by bacteria. The most common culprit is E. coli, which normally lives in the gut but can travel up the urethra and cause infections. UTIs are one of the most common bacterial infections worldwide. Around 50% of women will have at least one UTI in their lifetime. They are less common in men, but the risk increases with age due to prostate enlargement. In children, structural abnormalities, poor hygiene, or infrequent urination are also common triggers. Most UTIs are caused by ascending infection, where bacteria enters through the urethra and moves upward. In catheterized patients, the infection can occur due to biofilm buildup on the catheter surface. UTIs can look different depending on age. In adults, symptoms are usually clear: burning during urination, frequency, urgency, and suprapubic pain. In children, signs are often vague. Fever, irritability, vomiting, or poor feeding may be the only clues. In the elderly, the infection may present primarily as confusion or delirium rather than urinary symptoms. Now let's separate lower UTIs, such as cystitis, from upper UTIs, like pyelonephritis. Cystitis has symptoms of urgency, frequency, burning or pain when urinating, also known as dysuria, cloudy or smelly urine, and suprapubic discomfort. Pyelonephritis includes all of the above, in addition to fever, chills, nausea, and vomiting. There can also be unilateral flank pain, which is pain towards the midsection of your back. There could also be CVA tenderness, which is pain on tapping the lower back over about where the kidney is. And finally, signs of sepsis in severe cases. Diagnosis is based on symptoms and tests. Some of these tests include urinalysis, counting white blood cells and nitrates in the blood, urine cultures for bacterial growth, and blood tests for systemic causes. Pre-hospital management, especially for paramedics, focuses on assessment and supportive care. It's important to take a detailed history, check vital signs for sepsis, provide analgesia for pain relief, and if pyelonephritis or sepsis is suspected, you can administer oxygen if needed, start IV fluids for hydration and perfusion, and then transport urgently to hospital for management. Simple cystitis without systemic signs may be suitable for a non-urgent GP referral. In patients with urinary catheters, bacteria can travel up the tubing and form biofilms leading to infection. Purple urine bag syndrome is a rare, fascinating phenomenon where the urine turns purple due to bacterial breakdown, which produces pigments that react to the catheter plastic. This usually indicates long-standing infection and requires prompt review. Now, you may have heard of complicated versus uncomplicated UTIs. An uncomplicated UTI occurs in a healthy, non-pregnant person with a normal urinary tract. A complicated UTI involves factors that increase risk, such as catheters, diabetes, structural abnormalities, or immunosuppression, and often requires hospital treatment and IV antibiotics. What is pyelonephritis? Pyelonephritis is an infection of the kidney itself, usually due to bacteria ascending from the bladder. It's an upper UTI that can lead to urosepsis if untreated. Some risk factors for pyelonephritis include female gender, pregnancy, diabetes, catheters or stents, immunosuppression, and history of recurrent UTIs. In suspected pyelonephritis, assess for CVA tenderness, fever, and flank pain, and rule out other causes like appendicitis, renal colic, cholecystitis, and pelvic inflammatory disease. Pyelonephritis is a medical emergency, so following sepsis protocols, including oxygen, fluids, temperature control, and urgent transport, are imperative. Pain relief and antiemetics may be given en route, and in hospital, patients often need IV antibiotics and monitoring for complications like abscess or renal failure. In summary, UTIs might start simple, but they can climb fast. Knowing the difference between cystitis and pyelonephritis, recognizing risk factors, and managing sepsis early are key steps, especially in the pre-hospital environment.